Text on screen. This video is intended for clinicians. The 3M V.A.C Ultra Therapy System is an integrated wound management system that provides negative pressure wound therapy with an installation option. 3M Veraflo Therapy is indicated for patients with a variety of open wound types who would benefit from the application of topical wound solutions over the wound bed. Prior to use, consult detailed product indications, safety information, and instructions contained in the V.A.C Ultra Therapy System safety information, and 3M V.A.C Veriflow dressing application instructions provided in the dressing cartons. Additional safety information specific to the V.A.C Ultra Therapy System is available at the end of this video. Contact your local 3M representative if you have any questions before initiating therapy. Text on screen. 3M V.A.C Veriflow Cleanse Choice Dressing Mechanism of Action. A photo of a 3M V.A.C Ultra 4 Therapy System unit, the 3 layers of V.A.C Veriflow Cleanse Choice Dressing foam, a 3M V.A.C ruler, a 3M V.A.C advanced drape, and a 3M V.A.C Veritrack pad. A photo of a nurse securing a hospital ID band around the wrist of a patient. A photo of healthcare professionals in full personal protective equipment touching a dressing on the back of a patient in an operating room.
We understand that it takes more than medicine to heal complex acute and chronic wounds, such as ongoing clinical training, exceptional customer support and service, in addition to cutting-edge research.
A photo of healthcare professionals in full personal protective equipment. A photo of call center employees wearing headphones. A photo of a woman wearing medical gloves examining a container. Text on screen. V.A.C Veriflow Cleanse Choice Dressing Proposed Mechanism of Action. A photo of a patient looking into the camera while a doctor stands behind them and speaks on a phone.
Patients that present with difficult-to-treat or infected wounds, especially those exhibiting thick wound exudate, slough, or infectious materials, are particularly challenging to treat.
A slideshow of photos of difficult-to-treat and infected wounds on various parts of patients' bodies. Thick exudate, slough, and infectious materials present in each photo.
More so if they cannot tolerate or are not candidates for immediate surgical debridement.
Text on screen. V.A.C Veriflow Cleanse Choice Dressing for use with 3M Veraflo Therapy. A photo of a V.A.C Ultra 4 Therapy System unit with the 3 layers of V.A.C Veriflow Cleanse Choice Dressing foam, a V.A.C ruler, V.A.C advanced drape, and a V.A.C Veritrack pad. Disclaimer. In the event of clinical infection, Veriflow therapy is not intended to replace the use of systemic therapy or other infectious treatment regimens. Veriflow therapy is not a treatment for infection or a mechanism for installation of antibiotic solutions. It can be used as an adjunct in the management of infected wounds in conjunction with good clinical practice, such as debridement or antibiotic therapy.
Now there's V.A.C Veriflow Cleanse Choice Dressing for use with Veriflow Therapy that can provide immediate cleansing of wounds with thick exudate.
Text on screen. V.A.C Veriflow Cleanse Choice Dressing with Veriflow Therapy. A slideshow of 4 photos of a venous leg ulcer case during treatment with Cleanse Choice Dressing with Veriflow Therapy. Each photo shows gradual improvement of the wound after use of Cleanse Choice Dressings with Veriflow Therapy. Text of first photo. Venous leg ulcer at presentation. Systemic antibiotics initiated. Text of second photo. After 24 hours, Veriflow Therapy. V.A.C Veriflow Cleanse Choice Dressing with 1/4 strength Dakin solution. Text of third photo. After 10 days Veriflow Therapy. V.A.C Veriflow Cleanse Choice Dressing and saline solution. Text of fourth photo. Wound was fully closed 102 days post-grafting.
As these cases illustrate, you now have a simple adjunctive therapy for managing complex wounds when surgical debridement is delayed, not possible, or not appropriate for the patient.
Text on screen. Treatment. Dwell, 10 minutes. Cycle frequency, 1 hour. Pressure, negative 125 milliliters of mercury. Systemic antibiotics were initiated upon presentation. No debridement information was disclosed. Note, for all wound photos presented, photos and patient information courtesy of Kirsten Reeder, BSN, RN, CWOCN, and Elizabeth McElroy, RN, MSN, CRNP, CWS, CWOCN-AP, Tower Health System, West Reading, PA. As with any case study, the results and outcomes should not be interpreted as a guarantee or warning of similar results. Individual results may vary, depending on the patient's circumstances and condition.
Now you can immediately initiate active wound cleansing with V.A.C Veraflo Cleanse Choice Dressing and Veraflo Therapy to facilitate the removal of thick wound exudate, such as fibrin, slough, or infectious material, creating an environment that promotes wound healing.
A side-by-side comparison of an above-the-knee wound at presentation and later after 9 days of V.A.C Veraflo Cleanse Choice Dressing with Veriflow Therapy. The wound, once full of thick exudate, has healed considerably. Text on screen. Treatment. Solution. Hypochlorous solution. Dwell. 10 minutes. Cycle frequency. 2 hours. Pressure. Negative 125 milliliters of mercury. Note: for all wound photos presented, photos and patient information courtesy of Luis Fernandez, MD, FACS, FASAS, FCCP, CFFM, FICS, University of Texas Health Science Center, Tyler, Texas. As with any case study, the results and outcomes should not be interpreted as a guarantee or warranty of similar results. Individual results may vary, depending on the patient's circumstances and condition.
Wounds with thick wound exudate, including slough and infectious materials, are challenging to manage because they often include heavy bacterial bioburden.
An artist's rendering of the surface of the skin. Animated bacterial bioburden, rendered in green and purple, cover the skin. Text on screen. Bacillus, cocci, spirilla.
When managing these difficult-to-treat chronic and complex wounds, the goal is to quickly move the wound to the healing stage by initiating cleansing of the wound bed, removing of solubilized wound exudates and debris, and increasing granulation tissue in preparation for wound closure.
Text on screen. Artist rendering. Veriflow Therapy treatment goal. A drape and pad cover the wound as it is cleansed, exudate and debris is removed, and tissue granulation is increased.
V.A.C Veraflo Cleanse Choice Dressing, when used with Veriflow Therapy, is an option for clinicians when there is a need for immediate wound cleansing and when surgical debridement is not appropriate or not immediately available.
An artist's rendering of the 3 layers of the Cleanse Choice Dressing.
The dressing is comprised of 3 different layers. 1 wound contact layer with a novel array of 1 centimeter circular holes. 2 cover layers provide thickness options in wounds of varying depths. They can also be used for tunneling and/or undermining application.
Text on screen. Thin cover layer thickness of 0.8 centimeters. Thick cover layer thickness of 1.6 centimeters.
The novel array of 1 centimeter circular holes distributed throughout the wound contact layer are designed to provide mechanical movement at the wound surface in combination with cyclic delivery and dwell of topical solutions during installation therapy, facilitating the removal of thick exudate.
A 140 times magnification artist rendering of the 1 centimeter circular holes in the wound contact layer. Next, a close-up artist rendering of the wound bed surface covered by the contact layer and then cover layer of the Cleanse Choice Dressing. The contact and cover layers compress onto the wound bed and the thick exudate seeps into the circular holes of the wound contact layer during Veriflow Therapy. Text on screen. Veriflow Therapy activation with V.A.C Veraflo Cleanse Choice Dressing. Now, a topical wound solution is applied and floods the contact layer and the wound bed, filling the gap between exudate and the top of the circular holes and soaking with the exudate into the Cleanse Choice Dressing. The artist's rendering remains unchanged and the topical wound solution remains in place. Text on screen. Dwell phase. Under negative pressure, the topical wound solution is pulled upward and away from the wound and Cleanse Choice Dressing, and the dressing presses down into the wound surface. The exudate is pulled up into the circular holes of the contact layer. Text on screen. Negative pressure cycle activated. Slowly, the topical wound solution returns, filling the dressing and covers the wound bed surface. Now, an interior close-up inside a circular hole of the contact layer filled with topical solution. The dressing is pulled away to reveal the wound bed surface, as well as the bulging part that has been pulled up to fill the hole of the dressing. The base of the bulge begins to show blood coming through the exudate. Exudate and wound debris floats within the topical solution. Text on screen. V.A.C Veriflow Cleanse Choice Dressing. Mechanism of action at the wound bed.
The cyclic delivery of Veraflo Therapy to the wound bed facilitates the solubilization of wound debris, while the novel V.A.C Veriflow Cleanse Choice Dressing acts to facilitate the disruption of the solubilized materials in the wound bed.
The artist's rendering depicts the solubilization of wound debris during the soak phase and the disruption as the negative pressure cycle activates. Exudate and debris on the wound bed surface rise up and into the topical solution and cleanse choice dressing, away from the wound bed.
This combined effect cleanses the wound and helps prepare the wound bed for primary or secondary wound closure.
Text on screen. Mechanism of action results. A photo of a wound with thick exudate. Text on screen. V.A.C Veriflow Cleanse Choice Dressing with Veraflo Therapy. Treatment. Solution. Saline. Dwell. 10 minutes. Cycle frequency. 3.5 hours. Pressure. -125 milligrams. Text on screen. Photos and patient information courtesy of John Stuckbury, Albury Base Hospital, Albury, New South Wales. Note, as with any case study, the results and outcomes should not be interpreted as a guarantee or warranty of similar results. Individual results may vary, depending on the patient's circumstances and condition.
This patient's wound was treated with saline, 10-minute dwell time, negative pressure wound therapy cycle, 3.5 hours, and 125 millimeters of mercury.
A photo of the wound at first dressing change on day 3. A second photo of the wound at third dressing change on day 9. Treatment changed to V.A.C therapy at -125 millimeters of mercury for 30 days. A third photo of the wound at 4-week follow-up after split thickness skin graft. The wound heals gradually over the 3 photos.
This case illustrates the clinical results that have been achieved with V.A.C Veriflow Cleanse Choice Dressing for use with Veriflow Therapy.
Text on screen. Patient was ineligible for surgical debridement due to medication. No antibiotic therapy was disclosed. Text on screen. Photos and patient information courtesy of John Stuckbury, Albury Base Hospital, Albury, New South Wales. Note, as with any case study, the results and outcomes should not be interpreted as a guarantee or warranty of similar results. Individual results may vary, depending on the patient's circumstances and condition. A photo of a V.A.C Ulta 4 therapy system unit with a small V.A.C Veriflow dressing kit.
Following a dressing change with the V.A.C Veriflow Cleanse Choice Dressing, if the wound has little or no remaining infectious materials, slough, or other wound debris, consider transitioning to a V.A.C Veriflow dressing in combination with Veriflow Therapy. Transitioning to a V.A.C Veriflow dressing can help continue to prepare the wound bed to achieve final preparation for primary and secondary closure.
Photos of patients conversing with their doctors.
Put V.A.C Veriflow Cleanse Choice to work for you, and you too can put this unique mechanism of action to work in your practice.
A photo of the Cleanse Choice Dressing split into 3 layers.
V.A.C Veriflow Cleanse Choice Dressing, the simple choice for complex wounds. An option for clinicians when there is need for immediate wound cleansing, or when surgical debridement must be delayed or is not possible.
Text on screen. 3M logo build. 3M Science Applied to Life. Instructions for use and safety information. As with any device, it is important to read and understand the detailed instructions for use and safety information. including information on bleeding, exposed vessels, and organs, and infection, applicable to your V.A.C therapy unit and dressing application that can be found with the therapy unit, disposables carton, or in the V.A.C therapy clinical guidelines. These sources provide information concerning the proper application of all V.A.C therapy dressings, including advanced applications and techniques. If you have product questions or require additional product training, please contact your local wound care representative. Additional product information can be found at www.3m.ca/NPWT. Note: specific indications, contraindications, warnings, precautions, and safety information exist for these products and therapies. Please consult a clinician and product instructions for use prior to application. This material is intended for healthcare professionals. Copyright 2021 3M. All rights reserved. 3M and the other marks shown are marks and/or registered marks. Unauthorized use prohibited. Used under license in Canada. 2107-21216-E PRA-PM-CA-00237, July 2020. Available in Canada from your authorized 3M KCI distributors. KCI USA Incorporated, a 3M company. KCI owned and operated by 3M Company. KCI Medical Canada Incorporated, 75 Courtney Park Drive West, Unit Number 4, Mississauga, Ontario, L5W0E3, Canada. KCI USA Incorporated, 12930 IH10W, San Antonio, Texas, 78249.